Good morning. To the public discusses and those we could be present today. I am Dr. Christian Martinez, a specialist in internal medicine. Today with my colleague, Dr. Camila Mejias, infectologist. We will answering any question about what we should do before getting vaccinated and the side effects they could have after placing it.
Good morning. My name is Josue Diaz, and my question is directed to Dr. Camila. Could you tell us which are the most frequent side effects?
Good morning, Josue. Well, as were in your question, sometimes vaccines produce local or general vaccine. The local ones are in the puncture area, suction phase, inflammation or nodules, and redness in the area. And general ones see your whole body, suction fever, nausea, fatigue, among others.
Hello, my name is Rebecca Brazon from Aragua State, and I wanted to ask for you, what action should we take before getting the vaccine? Thank you.
Responding to Rebecca, mainly we must take into account our eyesight or hand symptoms. In case the person has been positive for COVID, she can be vaccinated in a stipulated period of time after her recovery. They must inform the professionals on the time of the appointment about any other disease or condition they may have. For example, if they are pregnant or a weak immune system.
Baker, now. Underlying significant proportion of the population is vaccinated. They have to continue using prevention measures. In the other words, we continue to use the mask, social distance, hand hygiene, ventilate the space. The objective is to vaccinate everyone to rule to future infections.
No, we hate to be patient. Creating immunity stain. You will be considered fully vaccinated after 2 weeks of the second dose, or at the Pfizer vaccine. 15 days from the second dose AstraZeneca, 2 weeks from the online dose of the G and G. Jason vaccine.
Are vaccines 100% safe?
Yes, although COVID-19 vaccines are being produced as rapidly as possible, they must undergo rigorous testing in clinical trials to show that they meet international vaccine for safety and efficacy. Vaccines can only be dilated by World Health Organization and the country's regularity bodies if they meet the standards.
Child population is galling to be vaccinated. COVID continues to be a threat to people who are not vaccinated. Some people with contrast COVID can be considered ill, which cause lack to hospitalization, and some people have permanent health problems for several weeks after being infected, or even longer. Let us be aware of a future victim of a pandemic.
Good morning. The truth is, I am very satisfied with the conference. If I am very informed, I am think we saw apply everything they have said and inviting Arquins to take care of themselves and go out get vaccinated. We I still have doubts, I am sure. The rest of the people in the conference also have things and know that the break is over. We hope to be able to discuss things and inform us more.
For the vaccination process, the selection of specific groups for immunization is being implemented. No. Why is divided into groups for the vaccination?
Rebecca, as long as resources remain scarce, immunization programs will prioritize certain demographic growth over others before progressively spreading this distribution to encompass in the population. The division by demographic group was based on thorough analysis of the scientific data, including the difference between the various group, geographic and social setting.
Are there differences between vaccines?
Vaccine works differently. All COVID. Vaccine elicits an immune response, so your body remembers how to fight the virus in the future. Is the way in which they fulfill this function. The differences then. Messenger RNA is a new technology never before tested in humans. Its development began in C19 and is now they are started to be used. With this RNA, those instruct the cells to make proteins from the source code do spike this S protein is the gate dominant the cell for the coronavirus to enter and replicate. Since it is fits perfectly into the ACE2 enzyme, the gateway to cells. On the other hand, the viral vector adenovirus, which has previously been used with the Zika and Ebola vaccines, and it's to introduce different virus to the coronavirus, which modify the DNA into the body. This harmless virus will make many copies of the RNA replication. The RNA will cause these cells to make the aforementioned S protein.